happy Easter weekend. I'm Minority Leader Sean Hornbuckle, and today we want to make something very clear to the people of West Virginia. We are here at the People's House today because House Democrats care. House Democrats, we care about West Virginians and what they want, and we believe that they deserve it now. We're embarking upon a special session. We want to talk about what that means, how we got here, and results that we want to see happen in our state because we care. Special session, it's like overtime in a basketball game. It's like extra innings in baseball. Didn't get the job finished, so you need more time. But only in government, it costs the taxpayers a lot of money every single day that we are here. And just like in regular session, my House Democrat colleagues and I, we want to make sure that your government is efficient and effective. That's why we're here today, to work on what needs to be done preparing for a special call. We'll also let you know what special session is not and what it should not be. It is not, let me repeat, it is not a do-over for red meat bills, for culture wars, and for divisive bills that just pull West Virginians apart. Everyone back home, you can go to the Eastern Panhandle, Southern Coalfields, Northern Panhandle, Huntington, Charleston, doesn't matter. Everyone would agree that we wasted a lot of precious time for West Virginians during our regular session. We tried to, and let me say we, the majority party, tried to take away childhood immunizations. Tried to take away childhood immunizations. And House Democrats, we stood tall with the governor, and we appreciate him vetoing that bill. We also, during regular session, we tried to implement kindergarten carry, and we should have been focusing our time on funding schools. We also wasted precious time during the regular legislative session on trying a book ban to criminalize librarians, when we should have been focusing on how to fund our parks and our libraries. Special session also had the notorious fake Women's Bill of Rights, which focused on so many wrong things for women and put West Virginians behind. So now we're here, but as usual, House Democrats were ready to work. And we also want to lead the way in a bipartisan manner. That's very, very important to us. We don't have the final say on the agenda, but we are asking Governor Justice and the Republican majority party to truly work with us in a bipartisan manner. We know that we have things that can get across the finish line to help with actual opportunities that the state has before us, and also to focus on solving real problems. This special session needs to be about fixing the IDD waiver program. This special session needs to be about child care. This special session needs to be about helping West Virginians lower their light bill. It needs to be about restoring money to state health care funds, and we want to stand with the governor on his promise to help expand agricultural opportunities and put in a lab at West Virginia State University. Up next, I will have our Minority Leader Pro Tem, Kayla Young, to start talking about how we feel about these items in detail.
Good afternoon, everybody. We're happy to have you here today. We're happy to see the revenue estimates come out from the governor's office today to show that we are, I believe, $522 million ahead of schedule in the excess revenue, and we are looking forward to spending that money in a special session on things that West Virginians want. And the main thing that we know that West Virginians want and need is access to child care. Throughout this regular session, we had a suite of about 7 bills that would help child care. It would help everyone involved. It would help the parents and the families with the tax credit, which I know everybody's filing their taxes, trying to get them in the next 2 weeks, and they can't take any breaks on their credit for child care in West Virginia. There's a federal credit, but not a state one, and we've heard the governor ask for it, and we've stand with him to ask for that child care tax credit, in addition to other bills that would have helped our child care providers, our families, and our businesses lower child care costs for families. And we fought for those all session, and we didn't see any of them. In fact, we saw a massive cut in child care funding. Over the past 10 years, there's been a 50% cut to child care funding in West Virginia. We don't think it's acceptable at all. We need to be lifting up our child care facilities, making sure there's access for families so they can be in the workforce, and making sure that our future leaders have the healthy development that they deserve and need. So we're looking forward to focusing on child care in this special session that's coming up. And now I'm going to hand it over to Delegate Pushkin to talk about the IDD waiver program.
Thank you, Kayla. At the 11th hour during the regular session, we received what wound up being the budget that passed. It passed with bipartisan opposition, by the way. And that budget, when it came back over from the Senate, I believe it passed with bipartisan opposition, not bipartisan support, bipartisan opposition. In fact, I think a record number of Republican no votes on the budget that is currently our budget until we go back in for a special session. I believe a big part of that was the drastic cuts to the IDD waiver program. That's money from Medicaid. Remember, when you cut that, you're cutting it 4 times as much because it's 3-to-1 federal match. And that particular part of the fund is used to help families take care of their loved ones who are the in most desperate need of help here in West Virginia. And I think that's why you saw such opposition to that bill. Now, going into the session, there was a study done and a recommendation was made that we increase the rates paid to the direct care workers, those who go into the homes and help families take care of their loved ones who need help taking care of themselves. Instead of increasing it, what we got back from the Senate was a drastic decrease. And that's just completely unacceptable. So we're going to ask the governor to fix that, put that money back. Unfortunately, we're going to hear about it here in a second, unfortunately, those cuts to the IDD waiver program are just the tip of the Medicaid iceberg that's been cut. And what we're talking about there, it's money that affects so many other things, like Delegate Young was talking about child care. That's part of how we pay for child care through those funds. It's how we pay for CPS workers to address the foster care crisis. There have been drastic cuts to this money where there's a 3-to-1 federal match. It makes absolutely no sense. I'm going to turn it over to Delegate Williams, who's going to talk more about the cuts to Medicaid as a whole.
Thank you, Delegate Pushkin. Ladies and gentlemen, where we stand today is in the state capital of the most unhealthy state in the country. And at the state capitol, we had 60 days to address the health concerns of West Virginians. And did we do that? We did not. In fact, we took significant steps back. As has been mentioned on the last night of session, we received a budget that cut Medicaid spending by around $100 million. The past few weeks, it's come out that it's closer to about $150 million that we're going to see cut in Medicaid. And there are some rumors that it's closer to $250 million. Now, I don't need to remind you about the 4-to-1 match that we receive from Medicaid dollars. So that's $1 billion right there. And I think about something that my memo would have said, and who's more wise than a West Virginia memo? She would have said that's penny wise and pound foolish. And I think we can all agree with that when we think about the health of our citizens. And you might have cynics question where this money was going, the types of procedures and individuals it was going to. Well, it cut millions of dollars from CHIP. I didn't come to this body, and I don't think any of these people next to me came to this body to kick children off their health care insurance. It cuts money going to rural hospitals. It cuts money going to teaching hospitals, trying to teach the next generation of healthcare professionals to treat this unhealthy state. So when we consider these $100 million cuts that keep rising, don't forget the factor that those get matched at a 4-to-1 rate. When we come back into special session, that has to be a priority. I can't speak for all my colleagues, but I'll have a really hard time supporting any budget that doesn't have full funded Medicaid programs. And with that, I will turn it over to Delegate Lewis.
Thank everybody for coming out. Good to see you all again. When we talk about cuts, one of the first things that the governor mentioned in the state address was the $50 million that was supposed to go to West Virginia State University's agricultural lab. This would not only be beneficial to our local area, West Virginia State University, but it's also going to be beneficial to our whole state. When we talk about health, when we talk about all these different things that can make our state better, this was definitely an initiative that could have done that instead of those funds got cut. Again, so we want to see that governor's promise fulfilled, and hopefully that's something we can work on in the special session. With that, I'll turn it over to Delegate Garcia.
Thank you. Good to be with you guys today. But I've been back home, I saw some firefighters this week, and they were very grateful about some of the things that have been done for firefighters across the state of West Virginia, whether that be volunteer or professional firefighters. But one of the looming crises that we have is what's happened with EMS. We've had 2 deaths here in, I think in 2024, in Mayfield County and Wayne County, people that didn't need to die. People that, because of the funding situation, because of some of these areas not having sufficient ambulance services, we had too long of a wait time, and somebody that could have otherwise lived didn't make it. That's a crisis that cannot wait until the 2025 special session. We have done some things again for permanent funding for firefighters and some EMS services, but this is an issue that we really need to work on. It may not be the simplest issue, but it's something that right now, whether it be stopgap funding or trying to make sure that we're working with counties to find a plan for how we're going to make sure this doesn't happen again, that has to be a priority. And the other thing that I think we talked about doing this year that we didn't do is with respect to correctional staff officers, correctional staff workers. Last year we gave a pay raise to correctional officers. And this year we came in and we said, we're going to be doing something for those other individuals that have really upheld our regional jails and correctional facilities during a time of crisis when we've had the National Guard coming in. Many of those people have been working jobs face to face with persons who are incarcerated, and they took us at our word that we were going to do something about it. And I've since been back in the jails trying to talk with people, and they're disappointed. But we have an opportunity here. We have the ability to come back in May, regardless of the reason why, regardless of the fact that we didn't get things done now, this is something that's important. And these are 2 of the things that we can do right now to make a difference in the lives of the people of the state of West Virginia. So next up, we're going to have Delegate Hanson that's going to continue.
Thank you. My name's Evan Hansen. I represent Morgantown, District 79. And the minority leader mentioned that special sessions are not a time to redo red meat bills. And I agree with that. We all agree with that. But there's a couple things that we do need to take a second shot at, things that actually help West Virginians, things that show that we care. And one of those is funding that was vetoed for groundbreaking research at the West Virginia University Rockefeller Neuroscience Institute. This is research that is amazing that it's happening here in West Virginia. It's research into treating Alzheimer's, research into treating substance use disorder. Things are impacting West Virginians at high rates. And we have a chance to push that research forward so that medical trials can be done to speed those products into market should they prove to work. This is something that's entirely appropriate and important for our legislature to support. Things that are not just going to help West Virginians and their families, but are going to spur economic development as Morgantown becomes the center for this type of research. So we want to see that back on the agenda in May. The second thing we'd like to see on the agenda in May, that I would like to see on the agenda in May, are steps to reduce our electric bills. One reason we have such high electric bills and that they're rising faster than other states in the country is due to our reliance on a single source of energy, coal, at a rate not seen by any other state in the country. We have opportunities to diversify our energy mix. One bill that was vetoed last session was a small tweak to our utility solar bill that would have allowed our electric utilities to build solar projects cheaper, that would have reduced bills not just for people like you and me and small businesses that are already in West Virginia, but it would have helped attract new manufacturers into the state of West Virginia, manufacturers that require renewable energy. And by the way, when manufacturers come into the state who require renewable energy, they may buy up a lot of solar electricity, but they're also going to buy coal-based electricity. Their suppliers, their employers, others are going to increase demand for more traditional types of electricity. So that's a win-win in the state of West Virginia. Another bill that has not been taken up for a few years, but we should take that up in the special session, is a community solar bill. That allows people and businesses to opt into a community solar project, buy a subscription to a portion of the electricity, and save money immediately on their electric bills. So with that, I'll turn it back over to the minority leader.
Absolutely. Do we have any questions? Yes.
Yeah, talking a little bit more about the budget and the Medicaid issue. I know that Delegate Williams wants to address that because I think the numbers that the West Virginia Center for Budget and Policy had put out was about 147 million cut that what happened in this most recent budget. But of course, the federal match makes that a really bad problem. I think the governor is on the same page as you all because he seemed to be kind of outraged by that. Talk a little bit more about that specific problem. I know we're in Medicaid Awareness Month now because that just kicked off, so be a good time to address that a little.
Sure, yeah, and you're right with Medicaid Awareness Month going on right now. And you have such a high population of West Virginians relative to any other state that receive Medicaid. And so to think that we would be playing with their benefits, there's no good reason for that. And the $147 million that the West Virginia Center for Budget and Policy mentioned comes from a variety of factors. We are underfunding it based on prior years, but you also have the MCO bill that didn't pass that was factored in. And so it's not as simple as just underfunding from prior years. There's almost this just repetitive knocking of the Medicaid system and the subsequent patients that have that coverage. And so it's incredibly important. I guarantee anybody who's watching this press conference will read anything in your article. They've got a handful of people in their lives that they know that are on Medicaid and that will be uniquely affected by this if we don't do something about it. So it's a massive priority near the top.
Thank you.
Thanks.
I have a question for Delegate Bushkin. I wonder if you might have a response to Senator Tarr saying that the IDP funding cut was in an effort to get DHS's spending under control. He's saying that the reason we made this cut was their spending was so all over the place, which we know from the split bill, and we had to start putting money in little boxes to try to understand where they're spending.
It's hard for me to respond to that statement from Senator Tarr because I believe it really makes absolutely no sense when you're specifically talking about the IDD waiver program. We know that we are barely paying enough people to attract people to the field of being a direct care worker, going into the homes and helping people who so desperately need our help. There was a study done. I said this earlier. There was a study done prior to the session that said we needed a significant rate increase to help attract people into this profession where we're horribly understaffed right now. What Senator Tarr did was the exact opposite of what was recommended by that study. So while there are always places we can look for in state government to eliminate waste, fraud, and abuse, not an IDD waiver program, not taking away money from those segment of our society who's the most vulnerable, needs our help the most. That cut made absolutely no sense, and it's not just us up here that feel that way. I said it was a record number of Republican votes against their own budget, and it was mainly because of those cuts to the IDD waiver program. And I believe a Republican delegate stood up on the last night and said rather passionately it was completely unacceptable. So don't just take it from us. There was plenty of opposition from both sides of the aisle on that. So I think that, with all due respect, the Senate Finance Chair is dead wrong.
I've been looking at a couple of bills that deal with elections and voters and still trying to figure them all out. And I think Delegate Bushkin, you spoke on House Bill 4350, appointments of candidates after a filing period. And then this sour grapes bill, 5298, candidates who lost in the primary cannot run for the same office under a different political party in the general election. I guess my question is, how does this affect the West Virginia voter?
Well, I'll address the first. First of all, we already had a sour grapes law in West Virginia. You can't, if you lose a primary, you can't get back in and run as an independent or Constitution Party or whatever party. If you run in the primary, you can't run in the general. But that first bill you talked about making appointments after the fact, The only people who benefit from that bill are incumbents. We didn't come up here to protect incumbents. We came up here to serve the people of West Virginia, and the people of West Virginia are better served when they have more choices on the ballot. I didn't see any good reason at all for that particular bill. That bill said that if candidates don't file, if there's no candidate that files for a certain office, that the local political party committees can't make that appointment to the ballot. The only thing that does is make less alternatives, less choices for voters. Democracy works better when we have more choices for voters, when we have more people participating in their democracy. So that it was a bad bill. I was incredibly disappointed to see it pass, and even more disappointed to see the governor sign it. Doesn't benefit anybody except people already serving in this building.
Delegate Hanson, this is probably a question for you in regards to the solar facilities bill. My understanding of that bill, the only thing it really did was it raised the incremental cap from 50 megawatts to 100 megawatts, then it took out the sunset provision. That was my understanding. The governor's veto message tried to make it sound like that bill would raise electric rates. I haven't seen any evidence presented for that being the case. Also, that was the same day that the Coal Association had their symposium, so he vetoed it the same day as that. I mean, do you think this was vetoed for legit reasons, or do you think this was vetoed in essence virtue signal to the Coal Association in an election?
I'm not sure he has a good understanding of how our electric system works, honestly. I mean, what you said is true. It removed the sunset date and it changed it so the utilities could build 100 megawatt projects instead of 50 megawatt projects, but it kept the same cap in place. So what that means, if you could do 100 megawatt instead of a 50 megawatt project, is it can be more efficient and save money. So that was a bill that would lower electric rates for those entities that opt in, that voluntarily decide they want to take advantage of solar, and it will help attract manufacturers to the state of West Virginia to create jobs. I can't tell you what was in his mind. All I can say is the veto message did seem more like a political statement than a policy statement.
Thank you.
I just wanted to clarify, are you expecting these red meat bills, as you're calling them, to come back for this special session? Like, can you clarify, is this something you're just pushing against, or are you hearing that might happen?
We haven't heard that, but we also know that it's unfortunately still campaign season. It's still campaign season, and that is why we wasted a lot of time during our regular session. Make no bones about it, I'm extremely blessed to be able to fight for the people of West Virginia with the folks on my right and on my left. We are always going to lead and be the adults in the room because we care. And all these issues that we've talked about today is because we care about West Virginia and what West Virginians actually want. And so we are actually pleading with the majority party and Governor Justice to put the issues that matter on the special call. We want to work with you. It's why we're here today. We just want to get this thing done for the people of West Virginia because we care. Thank you all. Have a good week.
Thank you very much.
Yes.